Hey everybody, I wanted to do a review for nursing pads. These are nursing pads. Okay. Just going to give you a quick background. I didn't get to nurse with Boomy, who is 16 months now, because when I first had him, it's a long story, but I got an infection, so not from the surgery, something else, so I couldn't breastfeed him while I was on the medication that I was on, and I didn't get a pump. I was going to get a hand pump, and I didn't get a hand pump till like 3 days later, so my milk kind of like went away, and then it was like stressful because the medication was making me funky and then other complications. So I didn't breastfeed with Boomy. He was bottle fed formula, Similac, and now Trevor has had the opportunity to have breast milk. And actually, when I was in the hospital again, because you guys know, I did have that heart complication, so I wasn't able to breastfeed with him for actually the whole time he was in the hospital. But since we've been home, he's been breastfeeding, and everything's been going really good. And actually in the hospital they had an electric pump, so I pumped every 2 hours, 3 hours. You know, I really pumped regularly because I wanted to keep my milk up. I'm not for or against either one. For Boomy, it was great to have the bottle. My husband and I had a really good system. He never needed the milk warm, so at night we just brought the bottles up to our room with just the milk, and we had like a container of powder upstairs, so we didn't have to go downstairs. It wasn't a hassle either way. The breastfeeding isn't a hassle either. We're doing really good with it. Trevor and I are doing really good with it. My older son, Boomy, never had an ear infection, never got sick, so all that, oh, you have to breastfeed because, you know, it helps with ear infections, I don't think so. And also the additives that they put in the formula nowadays, like the DHA and the ARH, or whatever it's called, I totally forgot, that was last year, is the same that's in breast milk. When we were young, and even, you know, back in like 2000, you know, early 2000, whatever, it just came out. So now it's, you know, it's the same. He has developed just as well as I think Trevor will with the breast milk. In saying that, now let me get back to what, oh my god, where's my timer? Sorry guys, very unprofessional. Okay, I have 7 minutes, that's good. So let me talk to you about these nursing pads. I've tried this brand, oh, I forgot to pick up the other one. This brand and the Luma something, whatever, the Lana Cane, whatever. Anyway, so this is the Johnson's pad. And I opened it up here, but I noticed that I should have opened it here. Anyway, I just want to tell you a little about them. They're this big, okay, and you think, oh, that's huge. But when you're breastfeeding and while you're pregnant, maybe your areola has grown, so that's why they make them this big. And this is not the biggest I've seen. So anyway, they're formed. I don't know if you can see that it's like formed to shape around your areola and your nipple. There is an indentation right here. Maybe if I hold it still like this. Okay, where your nipple can sit into, this is the inside, and go into this space right here, like nipple space, and because your nipple will protrude a little bit more while you're breastfeeding. So anyway, it's very soft on the inside, very absorbent. One of these pads lasts me all day. It does have an adhesive. That's what this little thing is here. Adhesive. It's not the greatest adhesive. It's one little thing here. But I guess they don't want to make the whole outside adhesive with adhesive on it, or like more than one place, because you have to move it around. Once you're moving your boob around to feed the baby, when you put your boob back in, or your breasts back in, you can just take the pad and move it to where your nipple is now sitting. If you have larger breasts like I do, they're never going to sit in the bra the same way. If you have smaller breasts and your breasts sit up, your nipples are kind of gonna always stay, and your areola are kind of always gonna stay in that one position, so that little tab is fine. If you have larger breasts, like I said, I do. That little tab is also fine because it's easier to move around and it sticks to wherever you move it to. As long as your bra really doesn't, like if you missed it, if your nipple's not where it's supposed to be and you missed it, it might get a little damp, but then you can still put it in a good position. I've been using these since Trevor was probably like 2 weeks old. And they're great. I use the other brand. I have to link it for you, or at least tell you what it is in the sidebar, because I don't remember what the name is, and I don't have the package, and it was a sample package anyway. These I bought originally at Target, and they were like $5.99 or $6, $6.50 or something like that, and I had a $1 off coupon. There's 60 pads in this package, and this lasted me for about 3 weeks. And I changed them every day. Sometimes I didn't need them, so, you know, so obviously, whatever. It's 30-day supply, but I used them in like 3 weeks, okay? Because sometimes you leak more than you do, or whatever. And you change them every time you take a shower, so there goes that if you take more than one shower a day. I like these because they don't make noise. That way you hear the elastic, so you're not going to hear that when you have it on. They're silent because they're soft on the outside. They don't have that like plastic, like, you know, from the 90s when like Always was making their pads with like that plastic, the plastic bottom, and it was real noisy. It felt like you were making noise every time you moved, like a plastic bag. It's not like that. That other brand I was telling you is like that, but they're bigger. So anyway, it's very soft. You can't see it through the bra, even though, I mean, it's a little thick. It's not a thin pad. I'm pressing it so it's kind of flat. It's not a thin nursing pad, you know, but you don't want it thin because you want it to absorb. Inside, once the inside gets wet, it forms like a gel. The only drawback with that is that once the gel, you know, really gets wet, the whole pad maybe will get wet with you. Some of it, you know, just from the taking out your boob and what have you, this outside soft sheet will kind of rip, or, you know, get really worn where you're always putting back your nipple or what have you, and some of the gel will come out, but it's a clear gel. It's non-toxic, obviously. I'm rechecking. It doesn't say, but it's a clear gel and it clumps, so you'll see it before you put your nipple in your baby's mouth, and just wipe it off, you know. What else? Oh, it's very breathable too. Like, you don't feel soggy or anything. You feel like, and your skin around your nipple is dry, even if the pad is wet, you know, so it really draws the moisture away, which is good because you don't really want too much moisture staying on your nipple, and you want it to breathe, but you also don't want to be leaking all over your bra and having to change your outfit every 5 minutes, because that's what happens. So anyway, this is the brand that I bought. This is the one that I like. This is my second box. If you want any information, I'm gonna link it to the sidebar, but it's johnsonsbaby.com. So they probably have some coupons on it. I'm going to look again for coupons, because I think I got my coupon with a trial pack or something, and I went out and I bought it. Okay, that's it. The only other thing, I guess that's a drawback, but not really for me, but I guess some people might need it, you know, they're not individually, oh my god, sorry, individually wrapped. So if you need to change your pads like 3 times a day, and, you know, you stick them in a diaper bag, your best bet is either to put them in a Ziploc bag, which I think is fine because they're dry, and you throw away the old ones anyway, or, I guess wrap them in, like, paper towel or something, or get a case, I guess, you know, maybe like the wipes case, get a wipes case and put them in there, because then it won't be too flat. So that's my review. I hope you guys enjoyed it. Not enjoyed it, but I hope you learned something from it. If you have any questions, I'm not an expert on breastfeeding. I don't plan on breastfeeding my son for that long. But, you know, just as long as he wants to, and it's healthy, I guess, you know, for as long as I want to, and long for him. I think he gained like 2 pounds since he's been home, and he's just over a month now, so that's good. I'm going to the doctor tomorrow, and I'll update you guys tomorrow. Bye. Any questions, leave me a comment, rate and subscribe. Thanks. Bye.